Hello and welcome to our presentation. Today, our group will be discussing workplace violence toward nurses, which is a critical issue impacting the safety, well being, and the healthcare system as a whole. This presentation was created by Hannah Lee, Sarah Galvan, Jessica Ruff, and Tony Cheedy, and we will cover key definitions, statistics, real world cases, and evidence based strategies to prevent workplace violence in the future. To begin, it's important to define key terms related to workplace violence. Workplace violence can take multiple forms. Physical violence involves force to harm another individual, while verbal violence includes threats or intimidation. Psychological violence affects mental well being, and sexual harassment includes any unwanted sexual behavior. We also see institutional violence, which stems from organizational systems, and lateral violence between colleagues. Finally, de escalation techniques help reduce conflict, and workplace culture refers to shared values and behaviors within an organization. Workplace violence significantly impacts nurses' safety and well being. It can be physical, verbal, emotional, or systemic, and it often creates fear, reduces productivity, and damages workplace culture. Recognizing these issues and using de escalation strategies are essential to creating a safer environment, not only for healthcare workers, but for the safety and well being of our patients as well. Looking at the data, workplace violence toward nurses is alarmingly common. About 85% of incidents are initiated by patients or clients. 61.2% involve verbal abuse, and 50.8% involve psychological violence. Physical violence occurs in 13.7% of cases, and 6.3% involve sexual harassment. These statistics show how widespread and normalized workplace violence has become in healthcare, especially towards nurses. Our first case is actually a series of accounts from emergency department nurses published in the journal Healthcare. Workplace violence is very common in emergency department settings and is a significant global public health issue affecting nurses' safety, job satisfaction, and patient care. Many nurses in the publication reported that misunderstandings between patients and staff, especially around expectations, stress, and urgency of care, often escalate into verbal or physical violence. There's also a disconnect between nurses and hospital administration, where policies and responses to violence are perceived as inadequate or unsupportive. This lack of alignment, otherwise termed as the empathy gap, contributes to increased tension, conflict, and unsafe working conditions in the emergency department. Workplace violence negatively impacts nurses' professional attitudes and well being, as well as the quality of care they deliver and patient safety. The study concludes that improving empathy and communication among all stakeholders, including nurses, patients, and administrators, is essential to reducing violence and improving outcomes. Over two-thirds of the nurses, when asked about workplace violence, said it was just part of the job. That normalization of violence in the workplace is a huge point for safety considerations and more. Understaffing can reinforce neglect and devaluation of the nursing profession. Nurses need to be staffed to ensure patients are being seen quickly, and this can sometimes de escalate situations. Security needs to be staffed to ensure safety of all employees, and underreporting was a huge issue discussed as a consideration for workplace violence against nurses. It's evident that violence towards healthcare workers is driven not just by stressful environments, but by deeper gaps in understanding between groups. Addressing these empathy gaps through better communication, policy, and collaboration is key to creating safer healthcare environments. Our second case is a detailed account from a critical care nurse who was physically attacked by a disoriented patient. Not only did she suffer physical injuries to her jaw, but she also experienced long term emotional side effects like PTSD. Not only has she missed hundreds of hours of work due to doctor's appointments, surgeries, acupuncture, and things of that nature, but she is also suffering in her personal life. She has difficulty trusting those around her, whether at work or in her day to day life outside of the hospital. This story is a reminder that sometimes we have to take our safety into our own hands. We're all aware of the risks of bloodborne pathogens and other diseases because we are taught about these things in school. They don't concern us because we're thoroughly educated and provided with resources to protect ourselves. But it would be great if it were the norm that when it comes to workplace violence, that it means not only organizational changes in some places, but also changes in nursing education and personal practice. We all know the risk of workplace violence is significant, but we also have so many tools available to help keep ourselves safe. While this nurse's life was changed forever, ours doesn't have to be. The 2025 news article here is about a Maryland nurse who is advocating for stronger legal protections and safety measures after experiencing or witnessing repeated violent incidents in the workplace. As previously mentioned, healthcare workers are significantly more likely than any other profession to experience workplace violence, making it a serious occupational hazard. Many incidents go underreported, and violence is often incorrectly viewed as part of the job. Lawmakers are pushing for new protections, including requiring hospitals to implement violence prevention plans and increasing penalties for assaults against healthcare workers. Some states, including Maryland, have already taken steps such as allowing employers to seek legal protection orders for threatened workers. Hospital systems and the government have the ethical responsibility to protect their workers. The American Hospital Association came out with a report showing that there is not only mental and physical suffering in these instances, but the annual financial cost of violence at hospitals was upwards of $18 billion. Hospitals also have an ethical responsibility to increase staff training on recognizing and preventing violence, as well as developing tailored safety plans that are implemented across all facilities. Documentation and tracking of violence to adapt safety plans is also critical so we can prevent more instances of violence in the workplace moving forward. Nurses play a key role in addressing workplace violence. Per the Nursing Practice Act, nurses must adhere to workplace violence prevention protocols if they exist and report all incidents appropriately. There are groups, such as the Emergency Nurses Association, who advocate for laws and further protections to be put in place to protect themselves and their patients as well. Nurses should promote education by recognizing, preventing, and de escalating aggression, and engage in team based training in order to improve coordination and response during incidents. Nurses also have an ethical obligation to protect their patients and staff per the American Nurses Association Code of Ethics. There are several evidence based strategies that can be used to reduce workplace violence. The American Organization for Nursing Leadership explains the importance of structure and organization as it helps staff clearly understand the necessary actions for prevention and response. Having a clear organizational system with the sole intent of defining policies, educating staff, establishing a designated prevention leader or team, and implementing a formal incident report system is critical to reduce workplace violence. The literature also emphasizes the need for adequate staffing and competent security presence. From the Journal of Emergency Nursing, having security present and sufficient staff overall to help in these situations not only provides a physical deterrent for violence, but also helps provide patients with expected timelines, such as wait times. And this has been a strategy used to mitigate workplace violence toward nurses. Lastly, according to the American Association of Critical Care Nurses, having a resource for counseling can significantly reduce the psychological damage caused by workplace violence, and ensuring the victim feels empowered and supported in reporting the incident can prevent a cycle of silence through fear. It would be silly to assume that we can prevent all cases of workplace violence, so having a competent council or committee dedicated to providing psychological and emotional support is needed when those cases inevitably happen. Our call to action focuses on changing workplace culture. First, reject the idea that violence is part of the job. Nurses should not view the workplace violence as a natural facet of the profession. It's important to honor the significance of a violent incident and take the necessary steps to report it and support fellow peers when it happens to them in order to foster an environment where tolerance for such incidents is low. Second, it's critical to know your rights and workplace policies. Familiarizing yourself with facility policies and available resources can stifle an environment where workplace violence flies under the radar and goes unchecked. And finally, support your peers to create a safer, more accountable environment. Supporting and looking out for your peers will help them and yourself feel more supported and protected when workplace violence does occur, while also facilitating conditions in which people are not encouraged to commit acts of violence. To close, we'd like to ask a few questions for discussion. First, who benefits from a system in which nurses are encouraged to accept workplace violence and not report it? Second, can you think of any other barriers that weren't mentioned that would prevent a nurse from intervening when they observe workplace violence or from supporting a peer who falls victim to it? Lastly, who should decide where the line is between a patient's right to care and a nurse's right to a safe work environment, and where do you think it lies? Thank you for watching our presentation. We hope that we've offered you some valuable insight into what workplace violence really means for healthcare workers. We also encourage you to think about how you can make a change moving forward in your career as a nurse. If you have any questions, feel free to reach out. Thanks again for watching.